The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
1 year ago today, Ontario declared a state of emergency as the pandemic that has reshaped our lives descended. And tonight, as part of a cross-TVO collaboration looking at how we lived this past year amid COVID-19, we'll examine how the virus arrived and spread from coast to coast to coast. Then, Italy was among the first countries to be sent reeling in this global crisis. We'll check in on how they're faring a year later. It's Wednesday, March 17th, and that's tonight on The Agenda. Remember how remote and odd it all sounded last February when some new virus was stalking passengers on cruise ships? How real it all became in short order, though, as the spread of the novel coronavirus prompted the World Health Organization to declare a global pandemic in March. Then, just a week later, a year ago today, Ontario declared a state of emergency. If it now seems a blur, with us to take us through just what happened for COVID to take hold in Canada, let's welcome, in Burnaby, British Columbia, Kelly Lee, Canada Research Chair in Global Health Governance at the Faculty of Health Sciences at Simon Fraser University. And back here in Ontario's capital city, in the downtown core, Dr. Alison McGeer, infectious disease physician and senior clinician scientist at the Sinai Health System. In the Harvard Village neighborhood, Colin Furness, infection control epidemiologist and assistant professor at the University of Toronto. And in the Corso Italia neighborhood, Jennifer Yang, health reporter with the Toronto Star. And we're delighted to welcome all of you here on this, well, what does one call it? Inauspicious anniversary that we're all observing today, 1 year later. Just to set up our conversation, let's play a snippet from a documentary that we're going to air immediately after this program. It's called Outbreak, the Virus That Shook the World. It airs at 9 p.m. Eastern Time. Sheldon, if you would, let's roll that clip.
China has reported the first death from a mystery illness believed to be a new strain of the coronavirus, which also causes SARS.
Are we going to see at some point in the future London being locked down? Is that possible?
This will be the new normal until a vaccine is developed.
Having just passed the grim milestone of 500,000 deaths, no part of humanity is immune or safe.
And thus, COVID-19 spread across the world. I would like us to go back a year. I would like us to go back to the moment when you first heard of this mysterious new illness that was coming out of Wuhan, China. Jennifer, start us off. At what point did you think, this is something we in Canada may have to worry about?
So, I was a global health reporter for many years, and I subscribed to these email listservs that send alerts about emerging new viruses. And I started noticing some of these reports out of China, around the holidays. And, I was actually on maternity leave at that time, so I wasn't working. But I really perked up. There were just signs that this was something to watch for. And for me, really, it was seeing how Wuhan, China reacted to what was happening locally there. When they went into full lockdown, that was a very serious sign. And I could tell that this was going to be a big problem, a bigger problem than I think a lot of people were recognizing. And, I started thinking, do I need to go back to work early from maternity leave, because it looks like this is going to be a big story affecting us here.
So that was December?
That was, I think January was really when it was picking up steam, but December, I think we first saw the early reports, yeah.
And did you go back to work early?
No, I didn't, but I contacted my editors and I said, I think I need to cover COVID when I come back.
No kidding. Okay, good.
Yeah.
Alison McGeer, how about you? At what point did you think, we got to start paying attention to this?
I think, well, clearly we need to pay attention to it right at the beginning. So it would have been December 30th or December 31st when I think the first flags went up in my mind. And I there was a period of a couple of weeks where I was hoping that it wasn't going to be what it kind of sounded like, which was either another SARS, which would have been miserable but at least containable, or something that was going to be much worse. Certainly by the end of January, it was clear that we were going to be in serious trouble globally.
Kelly Lee, when did it get on your radar?
I would say around New Year's Day. Anytime you hear about a cluster of atypical pneumonia, you kind of, lean in and start to think about, is this it? Is this the next one? And I think watching it unfold in China with the way the government responded was very, very telling. And I think that increasingly got me anxious in terms of, what was really unfolding before us. Meaning the incredible, I don't know how you would describe it. The word draconian comes to mind, but maybe you needed draconian measures at that moment. It was very involved, let's put it that way. Is that what you mean? That's right. The scaling up very quickly, the effort that the resources that were put into it. Clearly, there was something very unusual happening that you don't see every day. So this was, we always see a lot of reports of disease events, but this one was particularly, it was severe. Colin Furness, how about you?
I have to say, I think I lacked the imagination to really fully appreciate what was going on until March. The professional in me was terrified, and I think the personal in me just couldn't visualize it. So it ended up moving so much faster than I thought. And in February, I was thinking, well, this might be something to be very concerned about. And I think that was a very humbling experience to realize just how much denial could actually play into just underappreciating this.
Well, here is a bit of a recitation of what went down a year ago and more. Starting in January 25th, 2020, a Toronto man in his 50s becomes Canada's first presumptive case of the novel coronavirus after traveling to Wuhan. Then we go to March 5th, 2020. Canada confirms its first community case of COVID-19 in a British Columbia woman with no recent travel history or known contact with an infected person. March 9th, a BC man in his 80s with underlying health conditions who lived in a care home. He becomes the first Canadian to die of COVID-19. That's March 9th. March 16th, a year and a day ago, Prime Minister Trudeau announcing that Canada will close its borders to people who aren't Canadian citizens or permanent residents. March 18th, a year ago tomorrow, Canada and the United States mutually agree to temporarily close our shared border. March 23rd, Canada invokes the Quarantine Act, mandating all travelers isolate themselves for 14 days. Then we move to April 6, 2020. Canadians are advised to wear masks to stop asymptomatic spread. Not till April 6th. And on the same day, COVID-19 spreads to remote First Nations in Ontario, Quebec, and Saskatchewan. Kelly Lee, by mid-March, we are closing borders, but not before mid-March. When you're dealing with this kind of virulent infectious disease, why wouldn't that have been an intuitive thing to do earlier?
Yeah, that's a great question. I think looking back, we have to remember what we knew then versus what we know now. So what our Pandemics and Borders project team has been looking at is the use of these travel-related measures and how they've been used by countries around the world during this pandemic. And what we've found so far looking back is that travel restrictions can work, and they did work very early on in this pandemic for countries that acted quickly. The countries that had acted quickly, they reduced their virus importation, and they bought themselves time to put into place other measures such as widespread testing and contact tracing. So when I say early and quickly, I mean January. This is January early onwards. So very few countries did that, but some did, which was very interesting. Taiwan, for example, is watching very closely its neighboring country and put into place a lot of the measures that we have in place in this country. We still haven't really closed our borders. We have to say that. We have always restricted the borders. The question is, did we restrict them enough? Did we screen enough? Did we test enough? Those are the things that we need to take into account, and did we do it early enough?
Colin Furness, if I can pick up on the expression you used earlier, was it possible that the people in Ottawa who were responsible for making the decisions, quote unquote, lacked the imagination to see how big this could be and therefore didn't close the borders early enough?
I think so. And it might go a bit beyond imagination to just dealing with this really uncomfortable fact of asymptomatic transmission. I saw a case report on February the 10th that said there was a UK man who traveled extensively, infected a lot of people, never felt sick. There was just a very cold sweat that I got when I read that, because I thought that means the sorts of measures that we say we're doing, like taking temperatures at airports, this isn't going to work. And we need to actually really, really be worried about this. That fact, that took a long time. And whether we call that imagination or denial, that to me was a critical juncture or a critical time period where we could have been faster, where we could have been more preventative, more proactive.
So, Alison McGeer, if we had our time back, we should have shut the border earlier, yes?
Well, hindsight is always 2020. I think what Dr. Lee's pointing out is that we should have shut the border on the 15th of January, and I don't think that's possible. On the 15th of January, people didn't have enough data about how severe it was. I think if you know how your democracy works, what your citizens will listen to is variable place to place. Obviously, the proximity of Taiwan to China made it, I think, easier for them to have more information, but also the amount of preparedness that they had done after SARS because of their SARS experience meant that they could move earlier. I don't think Justin Trudeau could have closed borders on the 15th of January, which was when we needed to do it. It was in Oregon, clearly in the second week of January. And we not only would have had to close borders to China, we would have had to close borders to the United States if we were going to make a difference. So I don't think that I get the fact that if we had been able to do it, if we'd been able to maintain those closed borders, we'd be much better off. But I don't know that it was possible at the time.
No, I hear what you're saying. And Jennifer Yang, you surely do need the sort of political consensus that says we're going to do something extraordinary here that we could never imagine under other circumstances doing. However, we did have SARS. We had SARS 17 years ago, and we've seen numerous examples during the course of this pandemic where we appear not to have learned any of the lessons from SARS. Should that not have been sort of rumbling around in the heads of the decision makers in Ottawa?
Yeah, and I think there's been a lot of talk about that, is that, outside of Asia, Canada was one of the hardest hit countries from SARS. We experienced that here. We learned huge lessons. There were commissions, there were reports, and a lot of those lessons, were not applied, many people feel, when COVID started taking hold in Canada. And, there's a lot of talk, of course, about the precautionary principle and whether that should have been applied immediately. And that was one of the recommendations stemming from some of the SARS Commission reports. So, there are a lot of questions around that. But as, to Dr. McGeer's point, people were working with what data was available at that time. And there was a lot of things being weighed by decision makers. And obviously, I'm not one of those. But, it was a risk-benefit analysis, I think, in those early days, continues to be. But certainly a lot of the lessons from SARS, I think, were not adequately applied.
Kelly Lee, in those early days, what did we not understand about this coronavirus that, had we known it earlier or known it at the time, could have been much more wonderful in helping us fight this whole thing?
Well, I think it was already mentioned about the asymptomatic transmission. That was certainly something that we didn't really realize. The fact that that you could it was highly transmissible, and of course we have to remember we were coming out of record numbers of international travelers. In 2019, we had record number of international tourists moving about the world. So we're very hyper mobile as a planet. And in Canada, we had 3 consecutive years of record tourists coming into Canada. So all of this is exactly right. Was it politically possible to shut down a country when we haven't had this kind of virus before? And previous outbreaks have shown us that actually travel restrictions often don't work. They can be counterproductive, and they can actually be hugely disruptive, as we found out when we've restricted our borders. So they shouldn't be the first thing you reach for in all cases, and we've seen that. But we also know that every pandemic is different, and we've learned that, we keep planning for the previous pandemic, and now we've got a very different one that behaves very differently, that spreads very differently. So I think those are the things to take away from this particular event.
Colin Furness, I suspect a lot of people watching this or listening to this right now will well remember a year ago, we were washing our packages that came into our house. We were washing our groceries, but we weren't wearing masks. What changed to enable us to understand that, in fact, we really didn't have to wash down our counters and our groceries and our mail, but we did have to wear a mask?
Well, I guess we all have to admit that our state-of-the-art understanding of infection spread for respiratory viruses, and maybe even some cases bacteria too, are pretty limited. We know that touching surfaces with bacteria is a pretty risky thing to do. I think we've all assumed that tends to be the case for viruses, and may well be some. But it was a huge learning curve for us to say, wait a minute, the viral dose that you're going to get from touching isn't it. It's the droplets, and even more so, of course, what we understand now, the aerosols, that may not be all that infectious, but infectious enough if you get enough of it. So it's a very, very different kind of transmission than we'd all assumed. And every expert, myself included, in the early days was saying masks don't actually make sense because they don't protect you. Well, that's true, but what we weren't thinking about is what a role masks could play in disrupting aerosols and limiting droplets, and that was really the thing to worry about. Had we known that, had we had that wisdom back in March, we would have had a much shorter first wave. I'm not sure it would have done much beyond that, though.
Jennifer, I guess there was also a couple of things. Number one, had the order gone out for everybody to get a mask, there was concern that healthcare workers who truly needed our diminishing supplies wouldn't have had access. So that perhaps was one reason why the recommendation wasn't given. And the other recommendation given was people may not know how to wear them properly, and if you don't wear it properly, it's not going to help you. With the benefit of hindsight, again, how reasonable were those 2 points?
It is hard to remember now, but at the time there was a huge concern about a shortage of PPE. And, you might recall here in Toronto, local hospitals were even doing call out for mask donations. Michael Garron Hospital in the East End issued a call out, and people were donating masks. They were sewing masks for the hospital. I spoke with, family physicians who were calling around desperate for masks. There was a run on them, even contacting veterinarians and asking if they could donate their PPE. So, this concern of not having enough masks for healthcare workers who would be closest to infected patients on the front lines was, I think, a really important concern that was certainly weighted a lot in those early days. And sorry, Steve, what was your second question?
Oh, the second one was on the issue of whether or not people would actually wear them properly, and if they didn't, then how useful could they be?
And that it was also definitely a concern. Hospital workers, physicians, nurses go through really intensive training on how to don and doff PPE properly. And they often say that the riskiest point in time is when you remove your mask, when you remove your PPE. And, the professionals are really well trained in how to do that properly without self-contaminating. And I do remember in the early days, there was a lot of concern that people in the general public could actually be introducing more risk to themselves by wearing masks improperly. So there was definitely a lot of concern around that.
Okay, let's go back again a year ago, and I want to do another little timeline here, because before long, we were shutting everything down. Let's go back to March 12th and 13th, 2020. Ontario announces a closure of its public schools as Ontario's largest universities moved their classes online. March 14th, Ontario and Quebec limit visits to seniors in long-term care as Quebec declares a provincial health emergency. March 17th, Ontario and Prince Edward Island declare states of emergency. That's a year ago today, as Ontario orders the closure of all indoor recreation facilities, libraries, private schools, daycare centers, theaters and performance venues, as well as all bars and restaurants, while allowing takeout or delivery only. March 23rd, the Ontario government orders all non-essential workplaces closed for 2 weeks, but people can work from home if possible. April 17th, Ottawa deploys the armed forces to long-term care facilities in Quebec and then Ontario on April 24th to assist with outbreaks and critical staff shortages there. And then we go to Boxing Day 2020. Ontario begins its second province-wide lockdown in response to rising case numbers. All right, let's start with Alison McGeer on this one. What has guided our leaders in terms of what to allow open and what has to be shut down?
So, initially, I think we had very little to go on other than the only weapon we had against COVID in March and April of last year was in staying apart and using measures like hand hygiene and wearing masks to prevent droplets from getting from person to person. And so all you could do at the beginning was to go broad and say, we need to stop transmission of this virus. And we're probably willing to go overboard. We'd rather go overboard with stopping transmission than go under, which means that we're going to do everything we can think of. The goal was to stop everything that was not essential to life in the next 2 weeks. As time has gone on, we've tried to get a little more sophisticated about thinking about where the risks are. As Dr. Furness said, we figured out that it's droplets that are the major issue. So now you can start talking about how well masks work. And that means that the high-risk places are the places you take your mask off. Okay, so restaurants are a particular problem, and we can get a little smarter about what things we can have open and what things we cannot have open. But we're still really struggling, I think, with what we want to have everything open up to the limit of, letting the cases go too high again and overwhelming our healthcare system and having too many people die. Figuring out where that limit is, it remains a really difficult thing to do.
Yeah, Jennifer, maybe you can pick up the story there, because clearly places like Toronto and Peel, the nation's capital for a piece as well, were really suffering. But then you got lots of places north of the French River where they were having no cases at all, and yet the entire province was being shut down. What had to happen for the government of Ontario to say, we can take a bit of a more systematic, sophisticated approach to this? We don't have to shut the whole province down, just the areas that we're really concerned about.
Well, I think it's still very much an open question as to what the best approach for locking down is, and whether, regions should be locked down together or if entire swaths of the province should be locked down simultaneously. There is research showing that it doesn't work as well to lock down in a piecemeal fashion when there's high mobility between areas. And so, some studies out of Europe, for example, have shown that lockdowns are more efficient, more effective, and faster if you lock down a big big geographic area with a lot of interconnected movement versus just some of these very targeted, small, local lockdowns. And actually, I think in Ontario, we've seen that just locking down some regions and not others creates what they call these leaky lockdowns, where people will move from a hotspot like Toronto to, say, Niagara region, where there were lower case counts. And, I spoke to the medical officer in Niagara, and the first 6 variants of concern that they detected in that region, 5 of them were linked to travelers from Toronto. So, Toronto was in lockdown, Niagara had opened up a bit, but that kind of movement was happening.
Colin Furness, can I get you on that? I mean, we before we started taping, we joked about the fact that Toronto was in lockdown, but York region, just on the other side of Steeles Avenue, wasn't. Does it make sense, when obviously the virus does not respect Steeles Avenue, does it make sense to only lock down the city but leave the region on the other side of the street open?
The problem with doing big, wide lockdowns, although they are efficient, is that they cause more harm. There's going to be less capacity to do that without getting really harmed. I think what we didn't do is enough public education to say, please don't do this, and here's why. We pleaded. Mr. Ford's been on TV pleading with people. No question, he's been doing that. But I think you can't just tell people what not to do. You need to tell them why. And I think we have not, as a province, as a country for that matter, done a decent job of public education. before the crisis as well as during the crisis, just in terms of how public health works and how communicable disease works. So I think we could have done a better job, but I'm not sure locking everything down all at once would be sustainable for the lengths of time that we've done it.
Okay, fair enough. Kelly Lee, let's pick up the story with tracking and tracing cases. There are those who say in public health, these are hugely important things to do in order to get a handle on the virus. How well have we done at that?
Well, it's a mixed picture. I think, early on, if we go right back to the beginning around New Year's, the Public Health Agency of Canada did actually pick up the earliest signals. We have something called the Global Public Health Intelligence Network, GFIN, which actually provides that early warning data. And it did report on December 31st when everybody else also heard about these cases. The problem is that we don't have a robust system of actually doing something with that data, that we don't have a system of risk assessment and then really firm decision making to take forward actions that are needed. And we found this out, as we went along. So, just making use of that data by PHAC, by having some operational capacity to roll out the necessary things that need to be done, including contact tracing. So by the time we actually adopted some of those restrictions that you described earlier, the travel restrictions in March, we had 2,100 cases, and that's too many by the time you lock down, for example. We also were not watching really that carefully, I guess, other countries and what they were doing. We were thinking still, this can't happen to us. This is in Asia. It always happens in Asia. They always go through these things, and there was a little bit of complacency that no, well, let's try and avoid this as much as possible. We're describing it as draconian, and no, we could never do this in Canada. And in some ways, we're right in that our culture is very different. We can't do the same things in the same ways as other countries. However, there is also that sense of, we don't need to do them. We could do it other ways. We could do a suppression strategy rather than a COVID zero strategy. We all heard about the flatten the curve strategy. We adopted that quite early on. And so if you're going to do that, you do need a robust system of contact tracing. Not enough testing was done. And that really put us in a pickle in the end.
Alison McGeer, I've got to ask you about long-term care, which of course has been one of the key stories, maybe the key story during the course of the past year. Can you take us briefly through the steps that might have been taken earlier on in the piece that ultimately might have saved many lives?
I actually don't think that going into the pandemic with the state of long-term care it was in, that we could have saved the disaster that was long-term care. It's a really big, complex problem, and so there are things that we could have done sort of technically, but I'm not sure we could have done realistically. If we had taken long-term care staff, if we had rented out hotels for long-term care staff and kept them quarantined, there were stories in France where healthcare workers in long-term care homes actually stayed and lived in the long-term care homes with the residents and got them through the first wave. So we could have done that. I'm not sure practically we could have done that is the issue. And our long-term care homes were a tinder keg, okay? You knew as soon as the transmission was obvious on the Diamond Princess, it was clear that we were going to have this terrible catastrophe in long-term care. It was just not clear we could do anything about it. And I'm really hoping that we're going to learn from that, and we will be able to make some major changes in our long-term care system that will prevent it. But I haven't heard yet a convincing thing that we could have done to prevent the disaster once the pandemic started.
And just so I'm clear that I understand what you're saying here, because too many of the homes were 50 years old, because there were too many, like 4 to a room, because there were the congregate care settings were too densely populated, for those reasons, you think?
Yeah, because they don't have good infection prevention and control, because we don't pay the people who work there enough, because we have too many part-time workers cobbling together jobs, because they're inadequately trained for what they do. we can't stop the transmission of anything in long-term care homes, and you can't. It's not that easy not to transmit organisms in congregate care settings. And we haven't done a terrible job in hospitals, although we've had problems. But we have much stronger infection prevention and control programs in hospitals. We have much more space. We have much better ventilation. That it's the concatenation of and we don't value long-term care. It added to that, of course, we had a problem with the fact that because this is genetically similar to SARS-CoV-1, we thought that hospitals were going to be the problem. So what we did in Ontario, at least, was we really focused on making sure that we were preserving ICU space, that we were protecting hospitals, that we were doing what we thought was needed to make sure that we would have a healthcare workforce in hospitals and we would be able to cope with an ICU surge. What that actually did was make things worse in long-term care, because we told people that we needed not to admit long-term care residents to the hospital because we needed to keep hospital beds open. We actually emptied hospitals into long-term care facilities, making them more crowded because we wanted to preserve hospital space. We didn't give them any personal protective equipment. I do think, as somebody's already said, this thing about not having the shortages of things, we've kind of forgotten. People say we didn't do enough testing. We didn't have any nasopharyngeal swabs. You couldn't test because there wasn't anything to test with. So in the first month or so, there were a huge number of issues that were driven by these really simple practicalities that none of us had anticipated.
This half hour has flown by, so Colin Furness, perhaps you can wrap it up for us. Have we learned our lessons?
Not yet. The SARS report, which I have my students read, is a depressing read because we didn't implement much of what we learned from there. And the big thing that we knew last spring and we've known since then is inequity drives transmission. We only just got a homeless strategy last week for the province. Well, homeless itinerant folks are people we need to take care of and protect if we're going to protect everybody. So I think we haven't yet. And some of that's ideological, but you really need to take care of the most marginalized, racialized, vulnerable if you want to take care of everybody.
Jennifer, you want to take the last word on this? Have we finally learned our lessons on this?
I completely agree with what Dr. Furness just said. We haven't, and that's the missing piece, is really confronting the fact that it's the most marginalized members of our society who are at highest risk, and protecting them means protecting everybody. And some of the hardest steps to take to ensure that they're protected and that, that they are targeted for vaccination and that they have access to the healthcare they need to stay safe and that their workplaces are safe. None of, I think, the necessary steps to really plug those holes have yet been taken, even though there have been calls for that for months now.
That's Jennifer Yang from the Toronto Star. Thanks as well to Colin Furness from the University of Toronto, Alison McGeer from the Sinai Health System, Kelly Lee from Simon Fraser University. It's really good of all four of you to observe this first anniversary of what has clearly been the worst year in many people's lives who are watching and listening to this right now. Thank you for your contributions on TVO tonight.
Thank you.
Thank you.
Thank you.
Before the realities of COVID-19 lockdowns became a familiar story to everyone in Canada, countries hit earlier foreshadowed what was to come. Exactly 1 year ago, the epicenter of the pandemic was Italy. And we spoke to three people who were living a reality that was frankly unthinkable to us then. 365 days later, how are they and that country faring? Well, joining us now, two of those three from Rome, Italy. Ercole Rocchetti, reporter and documentary filmmaker with RAI, that's Italy's national public broadcaster, and Eric Reguli, European bureau chief of the Globe and Mail. It's good to see you two again. Good to see you upright. Good to see you looking as good as you are. We might actually, Sheldon, just for fun, let's bring up the picture because you were with us exactly a year ago. And let's bring up the picture. We also had Francesca Lamarca, who's an Italian MP, born in Toronto there. Eric, you had a different scarf on, but otherwise you look pretty similar. Why don't we start with this? There's another national lockdown in Italy. Eric, what's happened?
Well, what happened is that we're in a third wave. The new variants are taking over, specifically the UK variant, which is well more than half of new cases. It's partly our own fault. We got sloppy in the last few months, and we thought the worst was over, and it wasn't over. And so we're back in it now, and it's the whole country's not in lockdown, Steve. It's about two-thirds of the population. But, we can't do anything. Everything's closed. Schools are closed. We can exercise outdoors. Restaurants are closed. Bars are closed. You can only do takeout. And it's this endless, crazy open-close cycle, which is driving us all insane.
Well, we've got a chart here which reflects that which you just said. Sheldon, maybe you could bring up this graph here. And this tracks confirmed cases of COVID-19 from January to where we are right now. And for those who can't see it, who are listening on podcast, Canada is at the bottom. We've done not badly compared to others. Britain on top of us, the U.S. on top of them, the European Union on top of them, and there's Italy at the top of the chart, and the line on the graph is pointing towards heaven, which is not where you want these lines pointed. You'd like them flat or going down, if anything. Ercole, tell us now, how are Italians reacting to the fact that much of the country is under lockdown again?
Well, when we talked a year ago exactly, my feeling and was the feeling of most of the Italian was shocked, of course, because we had many people dying, but we were a bit optimistic because we thought that was something really. Was something that we had to do, this lockdown, was a sacrifice that was necessary for everybody. We were living a collective drama, but when you live a drama all together, you think that it's something better than a single drama. But by the time we had the feeling that this outbreak was fleeting, what we couldn't imagine that this was just the beginning. So the feeling we are having now, it's much more depressing, according to me, because now we have a very big problem with the economy. Many people are unemployed and will be unemployed when the prohibition of layoffs will be finishing. Many shops, restaurants, and hotels are closed.
Yeah, let me jump in here because we will get to the economic story later. I still want to focus on the healthcare story. And Eric, I'm going to come back to you for that. Talk to me about the fact you've interviewed the doctor who identified the very first European case of COVID-19. We're going back a year now, more than a year. How has her life been? How has the hospital situation been in terms of flattening the curve and making sure hospitals have not been overrun?
Okay, she's called Annalisa Malata. She's in her late 30s, and she was an ICU doctor in one of the towns of the original outbreak outside of China, actually. It's called Codogno. In late February, they had a problem. They had a lot of people coming in allegedly with flu. And a lot of people were very, very sick, especially older people. One young guy came in, he's called Mattia, and she thought, this is not right. She had heard about COVID, and she did a lung examination, and she was shocked by what she saw. The lungs were completely white. He couldn't breathe. He was dying. His blood oxygen was down to 50%. You're supposed to go to the hospital if it goes below 90. And she did here's the thing, Steve. She wasn't even supposed to do a COVID test. She broke protocol. Only Italians and Chinese who had come into Italy from China were getting these tests. She ordered the test, and that's the very next day. These 11 towns in northern Italy went into lockdown. I mean, she probably saved hundreds or thousands of lives by exposing this.
And what's the status of the hospitals now?
Well, I mean, not great. They're filling up again, and and I asked her what's the lesson you learned from this? What is the lesson that Italy can learn from what you went through, what the hospitals went through? She said, you have to invest in your public healthcare system. All the hospitals were hugely unprepared. They had no PPE, they had no ventilators, they didn't have the right doctors, they didn't have enough beds. Everything was wrong because they just weren't prepared for a pandemic. In northern Italy, they have a parallel private system, and that was bleeding off a lot of resources as well. So it made the situation worse. So her bottom line was, do not give up on public health care. We lost a lot of lives because we weren't prepared.
One of them that I'm glad we did not lose is the fellow you're on with right now. Ercole, last August, you got sick with COVID-19. Tell us about that.
Well, it was August 19, and I was on holiday, and I was not feeling good. I had fever, like 38 degrees, and I was not able to breathe in just a couple of days. So I went to the hospital, and they decided to record me for 5 or 6 days. And when I went back home, because I asked to go out from the hospital, they gave me a therapy because my saturation in the blood was like 90%, so I was not breathing much. And I was wondering why I was affected of pneuma. What's the name? I don't remember. Polmonite in Italian. I was affected of this problem, and now I'm thinking that it could have been COVID-19, because the story of Mattia that was talking about Eric is maybe a journalistic story, because it was the first cases that was proved that had COVID, but we know that traces of COVID-19 were found in the water in Milan in September 19.
Yeah,
that's sure. So who knows how many people was infected, was contagious of COVID-19 before we knew it.
And Ercole, how are you doing now?
Oh, I'm okay. Sometimes I forget the numbers while I'm writing. I forget some information because this is something that told me it could happen when you get COVID-19. I have many colleagues of mine that were tested positive for COVID-19. And they told me they had exactly the same symptoms. I mean, they forget the things a little bit. They are not able to write a story. They have no concentration. I mean, I don't have much this problem. I think it's much for the brief memory, the problem. But I don't know if it was COVID, but it was strange that I had this illness in August, and the other friend of mine were recovered in hospital for the same illness at the same time.
Interesting. Eric, tell me, how well is Italy doing at rolling out the vaccines?
It's a disaster. It's I looked at the vaccine tracker just before I came on the show, and only 3.5% of Italians have been fully vaccinated. That means they've had both doses. I think for the number of Italians who've had the first dose is about 10%. Now, it's not really an Italian problem, Steve. The European Union, the European Commission, I should say, set itself up last summer as the sole buyer of vaccines for all the 27 EU countries. And they were slow, they were tentative, they got bogged down in legal matters like liability, and the UK embarrassed us. They ordered massive amounts of vaccines 3 months before the EU did. So the rollout here is very, very slow. And on top of it, we have an AstraZeneca crisis. And, most of Europe now has suspended this vaccine. It'll probably come back in use in a day or two, but it's under suspension. So it's another blow. It's just been one problem after another. And to me, it's an existential crisis for the EU because this is their big test and they've actually failed it.
We should just clarify the AstraZeneca. It's a question of the viability of a particular batch, not the whole thing, just a particular batch that's in Italy right now. Is that the problem?
We don't know. No, there's been some incidents. There's been 5 in Europe, 5 or 6 suspicious deaths. These are relatively young people who died within days of getting the AstraZeneca vaccine, and there's been several dozen cases of blood clotting. The European Medicines Agency, the World Health Organization, and AstraZeneca itself say that there's the vaccine's safe. There's no causal link. They're not saying that there's no proof that the incidents and the vaccine are in any way related. We expect it to come back on the market later this week. But the point is, confidence in this vaccine is dying in Europe, and a lot of Italians and Europeans are now convinced it's a second class vaccine. They want the Pfizer or the Moderna vaccine.
There is some good news here, gentlemen, and the good news is that the third of the 3 amigos is now with us. Francesca Lamarca è qui, Toronto-born, but an MP in Italy's parliament, representing Italian citizens in North and Central America. Fra, we are delighted to welcome you this evening. Come va?
Thank you so much, Steve. Thank you. I'm really happy to be here. Thank you for having me.
How's the past year been for you? Just let's check in on that. Is everybody safe? Everybody feeling okay?
Everyone is safe, but it's been a very difficult year. That goes without saying, not just for me, but for so many. It's been an incredibly trying time, very isolating time, and it's for everyone. I would probably say especially so for Italians who are used to living in close proximity with one another. Very stressful, to say the least.
Eric, tell us this. You know, one of the problems we've had here in Canada is that we have not, until very recently, been able to create our own vaccines in this country. We just haven't had the infrastructure to do it. Do they have that capability in Italy?
Well, Italy is actually very advanced in one vaccine. It's called Reitera. It's in stage 2 trials. It's a Roman company, actually. So a lot of hope for that one. But so far, Italy does not have a vaccine on the market. What is great about Italy, though, is that there is a huge pharma sector here, which I did not realize till the pandemic broke out. So Italy, for example, is going to build a factory for the Russian Sputnik vaccine. Almost all the glass vials that the vaccine is put into, they're made in the Veneto region near Venice. The filling machines, almost all of them are made in Italy. So there's enough capacity here, is what I'm saying, Steve, that we could make in Italy a lot of vaccines in a few months' notice. And I think that is the plan now.
I just want to set up the fact as well that right after this program, Ercole, you're a documentary filmmaker. Well, we are making our own contribution to this subject with a documentary called Outbreak, the virus that shook the world. And it's focused on a few nations dealing with COVID over the past year, including La Bella Italia. Let's have a look at a clip from that. Sheldon, please.
By the middle of March, the virus had officially claimed more victims in Italy than China.
Ercole, can you tell us how have Italians come to terms with the fact that more than 100,000 of them have died?
That's something we really don't know why, because we have a very old population, and but also Japan has it, and they have very, very few deaths for COVID-19. Maybe it's because of our habits. I mean, the Italians are famous to shake the hands, to kiss at the cheek, and they huge. So maybe this could have contributed for the contagious and for the outbreak in Italy.
Francesca, can you share your thoughts on how Italians are dealing with so many deaths because of COVID-19?
The deaths, the high death toll, well, look, today we're almost at 103,000. You cannot, as a people, there's no doubt that this has left a profound scar on us as Italians. 103,000 deaths. Now, for one, of course, it is the number of senior citizens we have in this country. We have many elderly people. It's one of the oldest countries in Europe, if not in the world, along with Japan. And also the fact that, as I mentioned earlier, that Italians live in close proximity with one another. Cities are very densely packed and people live together very closely. And so that could also have contributed to the spread of COVID.
Can you also tell us, Francesca, one of the things that we've learned here in Canada is that the vast majority of people who've died were in long-term care homes. Has that been a similar problem in Italy?
Yes, it has been. I mean, that's where the outbreak first started a year ago. And, you know, we're approaching, in a couple of days, we will be celebrating or commemorating, rather, a significant anniversary, because exactly 1 year ago, the death toll in Bergamo, a small city in northern Italy close to Milan, was tremendous. Thousands of deaths in one day. And we remember March 18th of last year, where trucks, military trucks, just left the city with coffins, thousands of coffins. People were cremated. There was no room left in the city. They had no place to rest these poor bodies, and so they were taken outside of the city to be cremated. And so we will be marking that anniversary very soon. In January, Parliament passed this day, which is now a national day of commemoration of the victims of COVID-19.
Eric, I think we need to follow up on the economy here. Italy's economy was suffering already even before the pandemic hit. What are the prospects now post-pandemic?
Terrible. I mean, this could be the new crisis. I mean, this pandemic will end. You know, maybe not in the next few months. Or, you know, but let's say in the next year after most of the population is vaccinated. But the economy is in terrible shape. The GDP fell 9% in 2020. The first quarter is still in deep recession. The government has run out of money. It's now praying that the EU rescue fund will come through soon, but there's something like 35% youth unemployment. I mean, thousands and thousands of businesses have shut, especially small businesses. This is not an overnight repair job. This is going to be, you know, probably years. Thank God we have a prime minister now, Mario Draghi, the former president of the European Central Bank, knows a thing or two about economics, and he's got to buy time. He's got to keep the world buying Italian debt to keep us going.
Francesca, I'll give you the last word on this, and I wonder if you could tell us, in your view, is there anything about Italian society that you think will be forever permanently changed as a result of this? I think off the top of my head, you know, there are few people more tactile in the world than Italians. They love to kiss on each cheek and hug and so on. I wonder if you think all of that is gone now.
Well, firstly, I've not had a chance to say that I think the scars are very deep. I think that Italians are incredibly sad. We're carrying around these wounds that won't go away for quite a while. They will stay with us. You add to that the fact that we've just come out of basically a month and a half, 2-month government crisis, which has caused not just COVID fatigue, but COVID exhaustion. So people really are beyond exhausted at this point. And just a few days ago, most of Italy Italy's regions went into a red zone, including this region here where Rome is, the Lazio region, where everything is shut down. All businesses except for non-essential services have been shut down. So people, as I said, are beyond exhausted. As far as permanent scars, I want to be optimistic. I think that as human beings, we sort of have short-term memory. I would like to believe that we will only take what's positive out of this trauma and learn to be kinder to one another, realize how precious and fragile life is. But I really don't think so, with the exception of perhaps working online more so than in the past, as we've discovered to do well and efficiently. I think that it's only a matter of time that we go back to normal. And I hope that we as Italians will recover our Latinness, if you will, and go back to what you said, being touchy-feely once we've all been vaccinated and once we have that, once everyone has been vaccinated. I certainly hope that's the case.
I'm very glad we could get the three of you back together tonight on TVO to share your views on this. Francesca Lamarca, Ercole Rocchetti, Eric Reguli. Stay safe, you three, and be well.
Grazie, buonasera.
Grazie a tutti.
Grazie, buonasera.
Ci vediamo
Thanks
la
so
prossima
much.
volta.
Grazie mille.
And that is the agenda for Wednesday, March 17th, 2021. Tomorrow, the fifth installment of our joint TVO Toronto Star initiative, the Democracy Agenda. We'll examine the trouble spots for democratic governments that COVID-19 has exposed. Now, coming up right after this program, stay tuned for the documentary Outbreak, the virus that shook the world. Or you can stream it by going to tvo.org/COVID Inside Stories, where you'll also find all of TVO's coverage looking back at this year of living with COVID. That's tvo.org/COVID Inside Stories. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.